I'm Rachel. I'm with Sandwich KC, and we're so glad you could join us today for our What in the World webinar. For those of you who don't know about Sandwich, we provide information and referral support groups and caregiver education and self-care activities. You can learn more about us at sandwichkc.com. I'm super excited to have Heath Rath, Executive Director and the trailblazer behind the Pace Casey Adult Wellness Center, on with us today. I'm so pleased to have gotten to know Heath over the past year and just blown away by his hard work and commitment to older adults in Kansas City and Jackson County, Missouri. So I'm going to go ahead and turn it over to him so we can hear all about this awesome program.
Well, thank you so much, Rachel. I appreciate that very kind introduction. It's been phenomenal to be able to connect with like-minded professionals that are really dedicated to aging services here in Jackson County. So thank you for all the work that you and the folks at Sandwich KC are doing for older adults and the caregivers that are providing services to them. So wanted to start today by providing just a little bit of background and context about myself and what has led me to this point and why I've really focused on PACE specifically as a model of care. So we won't go way back, but I'll say that in general, 30,000 foot view, I'm in aging services because of my father. So he is currently 88 years old. And I recognized fairly early on in my life that my father was significantly older than the parents of my peers. So as I continued to grow old, mature a little bit, I recognized that with that, there was going to be a necessity for some caregiving responsibilities, and at a minimum, the necessity for education or to be well informed about what that would entail. So as I was going through undergrad university at Kansas State, I started with an anthropology degree and I really liked it, but I also wanted to have a job and gainful employment after college. So I decided to add a secondary major. And there was a secondary major opportunity of gerontology at K-State. And I took it because really I just wanted to gain a little bit more insight and knowledge about the aging process and what would likely be coming down the pike in regards to the care needs of my father. But I really loved it. I enjoyed the content, and I decided to add that as a secondary major. I then I had the opportunity to tack on another emphasis in long-term care administration and decided to make a career out of this. Through that opportunity, I added that long-term care administration track and became a licensed long-term care administrator. And I was very fortunate to be able to complete my AIT or administrator in training internships at two of the top skilled nursing facilities in the country, one in Manhattan, Kansas, and the other in High Point, North Carolina. And throughout that experience, I learned that nursing homes are a necessity for some, but even the best of the best in the country are not preferable to the alternative, which is aging in place. So I started to look at other options. What else is there out there besides skilled nursing? And I was very fortunate that I was able to get a fellowship at the National PACE Association in DC, in between undergrad and grad school. And that really opened my eyes to the fact that there were other care options out there that could provide nursing home level of care services without the nursing home stigma and the challenges associated with it. So that's how I kind of got to where I am today. After grad school, where I got my master's in gerontology, again with an emphasis of long-term care administration, I had the privilege of being able to work for Midland Care, a nonprofit agency out of Topeka, Kansas, and they were just starting the process of expanding their PACE program into Kansas City, Kansas. So I was able to come on board as their center director and get that program off the ground and running back in 2016 or so. And then had the opportunity to get it scaled a little bit for about 2 years. And then I became informed or was contacted by Swope Health, because they let me know that they were exploring becoming a PACE sponsor in the state of Missouri. At the time, there were no PACE sponsors or PACE programs in the state of Missouri, so we had to start from scratch. We kind of scratched and clawed our way to getting PACE passed as a permanent Medicaid state plan option through advocacy work with the state administering agency in Jeff City, Mo HealthNet, as well as working with our state representatives in order to effectuate PACE as a permanent Medicaid state plan option and having funding allocated through the legislature. So it's been a long slog. That started in 2018. But we are now up and running, and I'm coming to you today from the Pace KC Adult Wellness Center here in Kansas City, Missouri. And excited to talk a little bit about what PACE is and why I believe it is the best option for elder services that need really highly coordinated care. So PACE is really a pretty unique but complex model of care that most folks are unfamiliar with. So today I wanted to provide kind of an overview of the PACE model, but also review kind of what that development process was here in Jackson County. I'm sure there'll be questions throughout the presentation, so feel free to raise your hand in the chat or put something in the chat or unmute yourself and interrupt me. Not a problem at all. We'll also save a little bit of time at the end for Q&A. So with that, one second, I'll go to my next slide. So I'll start with this. I'm sure most of you, if you're on this call, recognize that our population is aging. However, I find that even folks that work in aging services typically underestimate the scale at which this is happening. So I included a few stats that I think depict the magnitude of what we're facing here in the United States. The reality is that the graying of America is extremely real, and we have to develop and implement innovative programs to address this demographic challenge. And I think that PACE is one of those innovative programs that can help us meet this challenge that we're facing as a society. So a few of these are the fact that there are 46 million older adults age 65 and older living in the US. But by 2050, that number is expected to almost double to 90 million. Baby boomers started turning 65 back in 2011 at a rate of 10,000 per day, and this will continue at the same rate for the next 20 years. And by 2034, older adults are projected to outnumber children for the first time in US history. The number of individuals with Alzheimer's disease or other dementias is also expected to nearly double by 2050, as well as Social Security and Medicare expenditures are supposed to increase significantly by 2050. Now, to put even a finer point on this, I've also included a few figures about where older adults like to age. So I have yet to meet an older adult who is just champing at the bit to go into a nursing home. People don't want to be placed or move into skilled nursing for their latter years. That's just the reality. And there's some figures here from AARP and the Joint Center for Housing Studies of Harvard University that state, 76% of older adults age 50 plus prefer to stay in their homes as their age. Harvard study showed that 87% of older adults age 65 and older want to age in place, while 71% aged 50 to 64 have a similar preference. Another study from AARP said that among older adults who have made home modifications, 80% believe that these changes have helped them age in place. So again, that really exemplifies the need for investment in order to have the ability to age safely in place in one's home and community. The other thing I want to point out is PACE organizations currently only serve about 1 in 10 that could benefit from the services in their communities, and that's through the National PACE Association. And of the 2.2 million lower income older adults that are expected to need long-term services and supports, PACE organizations just serve 2.5% of them. So there's a significant opportunity for PACE programs to grow and scale and serve a larger piece of that pie, if you will. So the history of PACE. Wanted to provide a little bit of context as to how we got here. The PACE was actually developed in response to the needs of an immigrant community of Chinese American immigrants in San Francisco that were looking for a more culturally acceptable mechanism to provide care for their older adults. Within that specific population, I think there's certainly more of a reverence for older adulthoods and more of a respect for the elders in their community. So they were not looking to warehouse older adults like is typical in the United States. So in 1973, there was an organization called Onlock, which is actually Cantonese for Peaceful Happy Abode. And they pioneered this community-based model of care that was intended to allow them to provide care for their older adult loved ones in the community rather than put them into a skilled nursing home. And that model just kind of blossomed over the next 20 years. And that community-based model evolved into what we now know as PACE. And Congress authorized PACE as a permanent Medicare provider and Medicaid state plan option through the Balanced Budget Act of 1997. There's more details in the middle there. A lot of good work was done by those pioneering agencies and individuals at Unlock. CMS then did a pilot expansion project, I believe, with 7 other programs across the country. That clearly went well because they were willing to proceed with expanding this as a permanent Medicare and Medicaid option across the country. So what is PACE? We know that PACE exists at this point, but how is it unique? How is it different? Well, PACE stands for Program of All-Inclusive Care for the Elderly, and it really is centered on the belief that it's best for older adults and their loved ones to age in their homes and communities whenever possible. So we do that, or we achieve that goal by delivering all the necessary medical and supportive services. PACE becomes the entire continuum and the one-stop shop for all services needed for enrollees into the program. So the main goal is to allow nursing home eligible older adults to age in place rather than being institutionalized either prematurely or inappropriately. And once you enroll in the program, we are 100% responsible for all of your health and wellness needs. And PACE really, we aim to keep our members at their highest level of function and independence possible. And we do so by providing really highly coordinated care and wraparound services by a full team of interdisciplinary medical professionals. So we'll get into the details of all of those IDT members or that interdisciplinary team here in a little bit. But I think it's important to understand that PACE is uniquely situated as both your healthcare provider and your health insurer. So we can be more creative and innovative in our problem-solving approaches than other programs that are MA plans or other organizations that are funded through Medicare and Medicaid. So to zoom out a little bit, let's look at PACE from a national perspective. There are currently around 160 PACE programs in the country, operating in 33 states now. This slide's a little bit outdated. PACE currently has about 75,000 beneficiaries across those 160 programs. And they operate over 300 PACE centers because one PACE program can operate multiple PACE centers. 53% of programs have opened since 2009, so there has been a significant amount of growth. I like to say that we're in the golden age of PACE right now because there's never been a time in PACE history that has grown as rapidly as it currently is. And 93% of PACE programs are currently not-for-profit, about 7% are for-profit. So, and to give you a little idea as to what that growth has meant in the states, Missouri, Illinois, and Kentucky have all added PACE very recently as an option. You'll see this graphic here doesn't even have Illinois as purple as showing it being a PACE state yet, but since this was created, Illinois has added PACE as an option. So before we discuss all the details and the services of the program, I do think it's important to understand some of the funding mechanisms behind PACE. Because as I mentioned earlier, that's what allows PACE programs to be creative and flexible with our care planning approaches. And we can provide services that aren't typically covered by traditional Medicare or Medicaid plans. So PACE is a capitated and fully risk-bearing model of care. So what that means is that PACE organizations receive a fixed monthly payment from Medicare and Medicaid for each enrollee into the program. These funds are then pooled and care is provided following a comprehensive assessment that of participants' needs conducted by the IDT. And then the IDT comes together and creates a highly personalized plan of care that's, again, laser focused on that goal of keeping people at their highest level of independence possible. And this bundled payment provides a strong incentive to avoid duplicative or unnecessary services and encourages the use of appropriate community-based alternatives to hospital and nursing home care. So if I state that in a different way, since PACE organizations are responsible for all-inclusive care, they receive all-inclusive payment. So for example, if an enrollee in PACE, Mrs. Jones, is enrolled in PACE ABC, she, like 92% of other PACE beneficiaries nationally, she's likely a member of the dual population, meaning she's dually eligible beneficiary with Medicare and Medicaid. Well, that PACE program would receive one capitated payment from both Medicare and Medicaid for all of Mrs. Jones's care, regardless of what it may end up costing the program. So they're fully at risk, as I said, and they're incentivized to provide high quality care via a more preventative and proactive approach than the fee-for-service world. Because if we're not doing our job to keep our folks at their highest level of independence and function possible, then we're going to ultimately see hospitalizations, ER visits, catastrophic events that could have been prevented and reduce that negative outcome for the individual, but also would have come at a significant financial cost to the organization. So it's unique in that the outcomes of the client are aligned with the financial incentives of the nonprofit organization. So I won't go into the details of how the Medicare and the Medicaid capitated payments are determined unless someone is very interested, and we have some Medicare or Medicaid reimbursement geeks on the line. Happy to go into the weeds on that, but feel free to let me know. But from a high level, that's what this looks like for the reimbursement model. So who can join PACE? The eligibility is completely governed by regulations that are set by both CMS, Center for Medicare and Medicaid, and the state administering agency that oversees the PACE programs in each respective state. But the three main criteria for enrollment are you have to be 55 or older, you have to live in the service area of the PACE organization, and you have to be certified to have a nursing home level of care need. Now, what that means is that each state determines what assessment tool or what criteria that they are going to utilize to qualify people functionally for enrollment into the program. So in the state of Missouri, they allow the PACE organization to use their tool. It's called the level of care assessment that asks questions about one's ability to complete activities of daily living. Are you independent with bathing, with toileting, with feeding? Do you have any cognition issues? Things like that. And if you score 18 or above on that level of care assessment, then you meet criteria and you can enroll in the program. But we also have to ensure that through assessment, the IDT, the interdisciplinary care team, is able to show evidence that this individual would be safe living in the community with the support that PACE can provide. So when we talk about the care coordination, I've mentioned the IDT. I always say this is kind of the secret sauce. One of the secret sauces is the PACE team. Because this is a graphic of the IDT, and each member of this team has a unique perspective on the needs of the participant. So from the doctor to the social worker, each member brings their own unique expertise and feedback to the table, and they meet daily to discuss the current care needs of each PACE member, and they frequently interact with each other and each participant so they can catch even those small issues and begin treatment as quickly as possible so they can prevent them becoming larger issues later on. And all decisions are made by the team and based on what's best for the participant to keep them as medically, physically, and socially stable as possible over the long term. Because PACE is long-term care. The IDT doesn't just focus on treating symptoms, but rather plans for future health concerns as member age. So as you can see from this graphic, the IDT consists of 11 team members in total. There's an RN, a life enrichment specialist, a dietitian, an occupational therapist, the center director, home care coordinator, personal care attendants, the transportation specialist, the primary care physician, the MSW or the social worker, the physical therapist. So that whole care team is really wrapping services around our participants to ensure that we're meeting their goals as frequently as possible. So covered services. I've kind of mentioned here a little bit ago that PACE is the one-stop shop. It provides a comprehensive set of preventative, primary, acute, and long-term care services that are all tailored to that goal of avoiding hospitalization or nursing home placement to the greatest extent possible. It's really designed to monitor even small changes because we want to make sure we're catching something as soon as possible. So an example I use, if I go back to the IDT, I frequently talk about the importance of every team member. It's not a provider-driven model. It is a very egalitarian approach where the transportation driver or the personal care aide has equal weight or an equal voice as the physician or the PT or the dietitian, because they often, those two individuals specifically, the driver and the personal care aides, they often end up getting to know our participants better than anyone. So they better understand what their baseline is. So the driver, for example, they pick someone up maybe every morning. They can really quickly identify that this participant is maybe a little bit off today. Maybe they're a little more confused or a less, maybe they're quiet when they're usually talkative, or they were a little bit less stable in walking to the van. Well, they can then pick up on that and go straight into the clinic when they come to the center and let the physician or the nurse know something's going on with Mrs. Jones today. She's not quite herself. We should probably check that out. And in that way, we can prevent those UTIs or catch them early, or catch a TIA or a stroke, or just prevent negative outcomes from a common cold or a flu. So it's really important that all of those team members are communicating and understand that they all have that equal voice at the table. So overview of our covered services. I feel like I'm belaboring the point, but it really is all-inclusive and the one-stop shop. So once you're enrolled in the program, we become everything. You can get PACE-centered day center attendance. We're your primary care physician, any outpatient medical specialty services, lab, x-rays, hospital, emergency services, any prescription drugs, any medication management. Home care is also provided by PACE. OT and PT and recreational therapy, any transportation to and from the center, and any outside medical appointments, all DME and medical supplies, dental, vision, hearing, nursing home care if you did need that, meals and meal support at home if you qualify, nutritional counseling and social services, family caregiver support, because we recognize how important partnering with family caregiver systems of our participants are. If their goal is to stay in their home in the community, then hopefully they have buy-in from family caregivers that can help provide that support. But we also recognize that that's a lot of work, and burnout is a very real thing. So we can work with them to connect them to resources like Sandwich KC, or connect them with our social worker for burnout support, or provide respite. Maybe they're going on vacation and their family or their loved one would need to be placed in a short-term respite stay in order for them to be safe. We can help coordinate that. And then we do also provide and coordinate end-of-life care as well. So how do PACE organizations coordinate our members' healthcare? It really starts with the clinic. So the PACE providers and the nursing staff operate the clinic at the PACE KC Adult Wellness Center. And PACE participants see the doctor on a regular basis. The doctor works with a pharmacist and nurses to coordinate and provide all needed medications and treatment. And medical attention is given as quick or as soon as issues arise. In the community, doctor's appointments, as I'm sure you know, can take anywhere from a couple weeks to a month or more. We're able to get folks in the same day or within a couple days, depending on kind of how we triage that level of need. So if we move from the clinic to the importance of the center is, I think, really vital because, as I'm sure you know, a lot of older adults feel anxiety or depression due to mobility issues or being socially isolated. So, within the same building as the PACE Clinic is also the PACE KC Adult Wellness Center. So, the day center is really a hub of activity where PACE enrollees can participate in anything from music bingo to arts and crafts, but they also can receive nutritious breakfast and lunch while at the center. And our recreational therapist, or we call them a life enrichment specialist at PACE KC, is that kind of activities coordinator person that develops programming that focuses on things like fine motor skills, spatial reasoning, cognition. So it's fun wrapped in, or how do I want to frame it? It's recreational therapy wrapped in the bow of fun, engaging activities. So that life enrichment specialist, they organize those group activities or individual activities to help reduce that social isolation. But they also work closely with physical and occupational therapy on site. On average, participants spend, 6 hours at the day center or so. Some people come in Monday through Friday, 8 to 5. Some people just come in once a week. Some people come in once a month. It's really, again, dependent upon that individualized plan of care. So earlier I talked about home care as well. That is a covered service within PACE because if our goal is to keep people in their home, then home care or services in the home are also required or often necessary. So it all starts with assessment. Our home care coordinator will meet with every new participant in their homes to get a clearer picture of how they manage day-to-day tasks in their homes. Can they cook for themselves? Are there any fall hazards? Is there any safety equipment that might be necessary? They'll also discuss medications with the participant and how well they're adhering to that medication regimen that they may be on. And this snapshot of home life is then brought back to the whole care team, where a plan of care is developed that is specifically intended to meet their home needs. So maybe they'll get some medical assistance or equipment placed in the home. Perhaps it's just some light housekeeping, or maybe it's a little bit more intense where we're providing showers or assistance getting ready in the morning or going to bed at night. So transportation services are also really important because transportation is often one of the single largest barriers to older adults remaining in their homes. So having access to transportation to and from their medical appointments. If you can't get to where you're receiving care, then you're not going to be able to get that care. So PACE helps break down that barrier and provides all transportation to and from medical appointments as well as to the PACE Center. We provide door-through-door service, and PACE drivers are specifically trained to work with older adults, and they really get to know each one of our members in the program. So lastly, I want to talk about caregiver support. So we're here at the request and invitation of Sandwich KC, which works closely with family caregivers. So I'm sure the folks on the line here have likely either been caregivers themselves or have worked with someone who has been a caregiver. And it is hard. But PACE supports caregivers so they can remain strong for their loved ones. We work with caregivers to provide the best possible care, and we ensure that they stay informed of any medical issues, medications, and treatments that we're providing. We really become a partner for families. PACE is found to significantly reduce caregiver burden and provide support to improving family caregiving. So, in fact, a stat from the National PACE Association is that more than 96% of family members are satisfied with the support they receive through PACE, and 97.5% of family caregivers would recommend PACE to someone in a similar situation. And nearly half of family members reported a high caregiver burnout at the time their loved one enrolled in PACE. More than 58% experience less burden after enrollment. Oh, excuse me. So given that we're on the topic of PACE services, I also included this graphic just to give you a little bit of a window into some of the care needs of a typical PACE participant. This is also data from the National PACE Association, where they've shown that the average PACE beneficiary is 76 years old. 70% of them are female, 30% are men, and the vast majority, over 85%, are 65 or over. The top diagnoses within the PACE population are vascular disease, diabetes with chronic complications, major depressive and bipolar disorders, polyneuropathy, and CHF. 46% of PACE enrollees nationwide have some diagnosis of Alzheimer's or dementia. And a stat I'm really proud of within the PACE community is this 95%. Because if you recall from earlier in the conversation, by regulation, 100% of PACE beneficiaries have a nursing home level of care need, but 95% live in the community. So that's a 95% success rate. Only 5% of PACE members nationwide have been placed in some sort of a long-term care facility or skilled nursing. So from a quality perspective, the efficacy of PACE has really been well documented over the years, and research has shown that PACE prevents or significantly reduces preventable hospitalizations. There is a 24% lower hospitalization rate for PACE enrollees than dually eligible beneficiaries who receive Medicaid nursing home services. The PACE rehospitalization rate is 16% less than the national rehospitalization rate of 22.9% for dually eligible beneficiaries that are age 65 and over. Reduced ER visits with less than one emergency visit per year, despite being at a nursing home level of care. And PACE participants live longer than enrollees in other home and community-based service waiver programs. Lastly, PACE enrollees are less likely to suffer depression. One study showed that 27% of new PACE enrollees scored as depressed on an assessment administered before enrollment. And then 9 months later, 80% of those individuals no longer scored as depressed. And then participants have also rated their satisfaction with PACE as a 4.1 out of a 5, and disenrollment rate is almost 5% less than other Medicare Advantage plans. So all to say, PACE programs have been proven to be effective in achieving their goals of keeping people independent and in their homes and have higher quality outcomes. Lastly, we need more evidence. Through the pandemic, the data was really clear that PACE succeeded in significantly reducing the likelihood of COVID-19 infection and mortality. Research through the National PACE Association showed that PACE members were around a third less likely to have a confirmed case of COVID-19, as well as a third less likely to have passed away due to COVID compared to skilled nursing home residents, which, as I'll state again, is by definition a like population. So to localize the conversation a little bit, who will PACE serve here in our community? It's all of Jackson County. So earlier I mentioned that PACE, in order to be eligible for a program, there's 3 criteria. You have to live in our service area, you have to be 55 or older, and you have to have a nursing home level of care need. Well, our service area here at PACE KC is all